Welcome to The Controversial Truth. I am Dr. Victoria Munoz, and this is Biohack Your Life. Welcome to our new series, Biohack Your Life. I am Dr. Victoria Munoz, and I am turning 60 this year. In celebration, I want to come here and teach you to become the best version of yourself. Though I am a medical doctor, I am not your doctor, and none of this information should be taken as medical advice. That being said, let's dive right in. Methylene blue is a thiazide salt and was first developed in the 19th century, 1876 to be exact, as a textile dye. It was soon discovered to be useful in medicine. Used as a stain in laboratories to view microorganisms under a microscope, it was soon discovered that methylene blue was a very effective antimicrobial. It was soon patented as the first synthetic pharmaceutical and was used to treat a multitude of conditions such as acute infection, psychiatric disorders, chemical poisonings, and more. Methylene blue was the first antimicrobial drug to successfully treat all forms of malaria. Industrial grade methylene blue is used in fish tanks to prevent fish from getting sick. When given to humans, it is made into a pharmaceutical grade substance, removing heavy metals from the product. Soon the patent ran out and pharmaceutical companies began manufacturing other drugs such as antibiotics for infections, psychotropic medications for mental health issues, and others. The reason for this was because methylene blue was no longer profitable, yet still very effective. Methylene blue is currently FDA approved for the treatment of methemoglobinemia. Methemoglobinemia is a rare blood disorder that affects how red blood cells deliver oxygen to the cells. It can be inherited or acquired through exposure to certain medications, toxic substances, or recreational drugs. Symptoms may include headache, dizziness, shortness of breath, nausea, poor muscle coordination, and cyanosis. Complications can be severe, potentially leading to seizures and heart arrhythmias. Treatment often involves the administration of methylene blue, which helps convert methemoglobin back to hemoglobin. So methylene blue is used in emergency medicine and given to patients IV as an effective antidote for carbon monoxide poisoning and cyanide poisoning. However, it is still used off-label for a multitude of conditions. Before we discuss the many uses in medicine and health that methylene blue has, let's look at its mechanism of action. So methylene blue is both an electron donor and an electron acceptor. When taken, it targets damaged cells first. It enters the mitochondria of the cell and goes directly to the electron transport chain. Now, just to reiterate what the electron transport chain is, for those of you that may not know, the electron transport chain is a part of the cell that produces our ATP. So let me be a little more specific. Inside the cell, we have an organelle called the mitochondria, and this is basically the power engine of the cell. It determines basically our life outcome. Electrons are transferred from the Krebs cycle to the electron transport chain, and the electrons pass through a series of 4 complexes before it gets to ATP synthase, where ATP is produced. Now, anywhere along that chain, there could be damage or a block in the chain, disallowing the electrons to make it to ATP synthase to produce ATP. What methylene does is it bypasses complex 1 through 3 and donates electrons directly to complex 4. Electrons are then directly transferred to ATP synthase, allowing for oxidative phosphorylation and the production of ATP. In addition, methylene blue will scavenge ROS, or reactive oxygen species, and carry them out of the cell, essentially detoxing and repairing the mitochondria. Now remember, ROS, or reactive oxygen species, are basically the byproduct of energy production. If left in the mitochondria, they can do damage and create mitochondrial dysfunction. Mitochondrial dysfunction is the basis of most all disease. The only differences are the cells that are affected. For example, with Parkinson's, we'll see damage to the cells in substantia nigra. Dementia, we'll see Lewy body and tau entanglements. With acute infection, we've got viruses, parasites, bacteria, yeast affecting the cells. With mental health issues, we know there's a very strong correlation between the brain and the gut, and somewhere along the way, there's dysfunction in these cells. Many functional medical doctors are using methylene blue as an adjunct in the treatment of other conditions such as cancer care. I would encourage you to read Dr. Thomas Seyfried's many publications and books on cancer as a metabolic disease. The bottom line is that methylene blue plays a major role in mitochondrial repair. Methylene blue is a very powerful nootropic used in the improvement of neurocognitive function. Methylene blue has a strong affinity for nerve tissue, so remember what we said. Methylene blue, when taken, will target damaged cells first, while methylene blue has an even stronger affinity for nerve tissue. By taking methylene blue, you can experience both an immediate and long-term effect of both cognitive improvement and memory recall. Methylene blue is often used in conjunction with regenerative medicine therapies, such as red light therapy, hyperbaric oxygen treatment. It can be used with ascorbic acid for a very powerful detox of nerve tissue. And if you take methylene blue about an hour before you go out into the sun, you will notice a very synergistic effect in energy, focus, and alertness. Methylene blue works as an MAO inhibitor, which is a monoamine oxidase inhibitor. When a patient is taking an antidepressant such as SSRI, SNRI, or MAOI, caution should be taken when taking methylene blue. Now, we've never seen any problems when methylene blue is taken in low doses by mouth. However, caution should be taken when methylene blue is given to these patients in high dose IV. The reason for this is because there is potential for serotonin syndrome, though it's only been documented one time. The patient was on a very, very high dose of an SSRI. It was given very high doses of IV methylene blue. COPD deficiency is another concern. Most people know they have this early in life. However, again, in low doses taken orally, this has never shown to be an issue. It's typically high dose IV administration where we need to be concerned. You can, however, test for G6PD deficiency through a simple blood test. And then pregnancy and breastfeeding are also a contraindication. It is unknown how it will affect the fetus or the baby. So when I give methylene blue to my patients, I start low and slow. I start my patients with 5 milligrams, which would be 10 drops of a pharmaceutical grade solution once daily. Patients may increase by 5 milligrams per week as tolerated, up to 60 milligrams. The sweet spot seems to be between 15 and 25 milligrams daily. Safe dosing is considered to be 0.5 to 2 milligrams per kilogram of body weight. Most people don't need this much, and remember, more is not better. When you take methylene blue in lower doses, it has a very strong health modulating effect. Larger doses are used to treat acute conditions such as acute poisoning and infection, and this should only be administered very, very short term. Methylene blue can be given as liquid drops, which is what I prefer, and oral troche, which is something that you just put in your mouth and let it dissolve, or topically for different purposes. Methylene blue, again, can be mixed with ascorbic acid for added benefit. They work very, very well synergistically. Though methylene blue is generally safe and side effects are very rare, your functional medical doctor can guide you in the treatment of disease and monitor progress. This is important for the long-term benefits that methylene blue can offer. When treating disease, lab work, and other exams would be indicated. For general wellness, methylene blue is an amazing way to improve mood, energy, and general well-being. So in summary, methylene blue is very effective in the improvement of memory, focus, and concentration, optimizing energy, creating health and longevity. In medicine, it is used to treat acute poisoning, acute infection, and as an adjunct to the treatment of many other conditions. I am a doctor that uses methylene blue with my patients. I also use it myself. If you're interested in learning more and how you can implement methylene blue into your daily routine, you can certainly contact me. My contact information is in the description below. I'm Dr. Victoria Munoz. Till next time, take care.